Hi, thanks for watching a new episode of the Doctor Podcast, Sykert File Show. This is episode 102, 102, and we've got another great guest today, and we're discussing a very, very important medical issue, and that is organ donation. Most of you hopefully don't need an organ donated right now, but you never know when you will. So it's very important that you watch this and help people who need organs to stay alive. And today we have one of the world's leading experts on the subject of organ donation, Leonard Chan. And Leonard's journey began as a critical care nurse at the Mount Sinai Hospital in New York City, where he earned his RN or registered nurse degree, Master of Arts degree, and also an adult nurse practitioner degree or ANP. For 25 years, Leonard transitioned from bedside nursing to hospital executive roles, notably the chief access officer and senior associate dean at Mount Sinai Health System. And he also served as the chief innovation officer and then inaugural president of the Innovation Institute for Hospital for Special Surgery, HSS, which is the top orthopedics hospital in the country. And that's before he came to the organization, which we'll talk about today, which is called Live On New York, or Live ONNY. In 2021, Leonard was appointed CEO of Live On New York, where after initiating a strategic plan, he's driven a 70%, that's 70% increase in organ donations in the New York metro region in just 2 years, from 2022 to 2024, which is an incredible accomplishment. Leonard's evolution reflects a blend of clinical expertise, a passion for addressing healthcare disparities, and a strategic vision that turned around Live On New York's performance from one of the country's lowest levels to a top tier organ procurement organization, or OPO. We'll find out more details now. So, Leonard, thanks for taking the time from your busy day to join us today to talk about organ donation, a very important topic.
Thank you for having me. Appreciate the advocacy and everything you do for the healthcare community. Thank you.
Thanks. So, you started your career as a critical care nurse at Mount Sinai here in New York City, caring for patients in the intensive care unit. Can you take us back to those early days? What sparked your interest in healthcare, and how did those experiences shape your perspective on organ donation, which is what you're currently doing?
Sure. When I was 9 years old, I was on a vacation with my family in Florida to Disney World. And on the way back to the airport after that vacation, a drunk driver unfortunately hit us at about 90 miles an hour, no
Wow.
brakes. And it was in the newspapers because we were a New York family. I was 9 years old at the time and ended up in the hospital for quite a bit. And I woke up, when I did wake up the next day, had these wonderful nurses caring for me. And I was left with an interesting impression through that first week. One of them said, "Hey, I'm not going to be here anymore. I'm signing off." And I said, "Well, thank you, doctor." And, he said, "No, well, I'm a nurse." And I remember kind of my mind thinking, "Hey, boys are doctors, girls are nurses, what's going on?" And wow, you're a nurse, and it left an impression on me that, quite frankly, I didn't really remember or think about until I was in high school, much later in life. But I never forgot the care. I never forgot getting back on my feet, them working with me there. And I decided in high school that that was what I wanted to be, was the profession I wanted to pursue and help people in that way. So it's interesting when I reflect back how that left such an impression on me. Yeah.
That's an amazing story. I wasn't aware of that. Glad you recovered fully from it.
Definitely. And then, being in the critical care environment, as you know, it really teaches you a lot. And it makes you, of course, appreciate life, but you see so much. And the patient population, one of many patient populations that I cared for when I was med tele and med step down respiratory care and then the medical ICU, were patients waiting for transplants. And at that time, I was very ignorant about the donation side, as we'll talk more about. But in a lot of ways, New York didn't build a culture in it. And I can remember coming home. I can remember being in the unit. Remember speaking to colleagues, always wondering why a patient had to lose their life waiting for an organ. when in fact I was probably a part of the problem because in the bed next door were often donors, patients we cared for who said yes, but I didn't understand the connection. It wasn't something taught in nursing school. It's not something taught, at least in New York, within the educational system or even coming up through the hospital system. And it's easy for me now, 25, 26 years later, to look back and remember that. And when I was called to take on this role, that was really the pinnacle moment that hit me in speaking with the recruiter and then talking to the board. I thought that, you know what? I am part of the problem, at least here in New York. A born and raised New Yorker, first generation, a nurse practitioner, somebody who's been through academic medical centers, many schools, had many roles, and have never learned about in a big way the beautiful impact of donation. So I thought, what if it wasn't about projection? What if it was about reflection? What if it was about me? And what if there were others like me? Could a strategic plan be written to turn this around? And that's then, and that's about 3.5 years ago, when I said yes to come in to try my best to serve community in this capacity.
Your career took you from nursing to executive positions at various academic medical centers in New York City, including Chief Communications Officer, Chief Access Officer, Chief Innovation Officer, just to name a few, before you landed at Live On New York. How did these roles that you had prepare you to take on the challenge of transforming an underperforming OPO in New York City?
Yeah, when I was called for the role and I thought about, how many lives could be impacted, but how many may have been lost, and I spoke to the recruiter and I spoke to board members and people in the community that I knew. I was reflecting back on what were the issues, right? Just like a differential diagnosis, right? Like you're thinking like, all right, what are the issues and what could they be? And I kept finding my way back to myself, back to there's a gap. We're New Yorkers, and if you leave a blank in a sentence, we're gonna fill it in. And, that's where my background in access, for example, operations, logistics, thinking about the movement of beds, transferring patients in international business, I thought maybe that could lend a hand to turning this around. Communications, right? Hired people way smarter than me my whole career who taught me the art of media engagement, communication strategy, PR, advertising, marketing. Was there a component here that could be used to engage media, create advocacy, but at the same time dispel urban myths, misconceptions, the very many things that I believed even 4 years ago, right? And then, across the board of commercialization, innovation, so much being done to advance our field. There's a lot of room for improvement. There's a lot of innovation that needs to take place in regard to just fixing things, technology, the algorithm. I know you've covered xenotransplantation, right? Eye transplantation, things that Live On New York as the OPO worked with our donor hospitals and transplant centers to make happen thanks to a donor saying yes. So at the end of the day, I've sat in pretty much every seat except the CMO or CFO. I understand the hospitals. I was born, raised through, came up professionally on the hospital side, and that gave me two benefits. I've sat in those seats. I know where I've done the wrong thing, where out of ignorance, where I didn't know better. And that helped me think of if we write a strategic plan and we could take an approach to fix a problem, how would I write that against the former me? How would I write that against myself? How would I write that against each of the roles that I sat in at the table, where if I didn't know better, we would have ignored this problem and never looked to fix it. And that's how those roles just came together. It's easy to speak about, in retrospect, but they just lined up and came together for me to bring a team in, come from the hospitals, understand that environment, and then since we work with and engage mostly with our donor hospitals, how do we get back in? How do we engage and communicate? How do we educate? How do we say, hey, we might have all missed something together in the last 2 decades. Let's turn it around together. Let's
Very
collaborate.
interesting. It's almost like somebody had a plan for you, but they wanted you to have these various careers first so that you would gain all these experiences and then put them together to do what you're doing now.
Yeah, I'm glad that it makes a difference. To me, I was just moving along and I knew, midway through my career, I knew that it was kind of cool to be able to sit in each of those seats. And, when I was a nurse, as you know, we could care for 2 to 12 patients at a time, depending on the unit you're in and what you do. But early on, when I took the leap into administration and thought about management, it wasn't about title, it wasn't about money, it wasn't about any of that. It was me realizing that I wanted to have a larger impact. And if I could influence that through leadership and management, then let me try that. So back then, I was just moving straight ahead in trying to scale impact. Now looking back, yes, it's pretty interesting that I've been able to, build a career that could contribute in this way.
Give us an idea about the data. How many kidney transplants are needed in the New York metropolitan area, or hearts and lungs and livers?
Sure.
How many people are waiting and unfortunately dying before they can get those organs?
Yeah, too many, right? So in New
Yeah.
York, and then we'll speak nationally, but in New York, there's about 9,000 people of our colleagues, friends, neighbors, family members who woke up this morning who are on that wait list. Now, that's those who are on the wait list. And about 80% of that are people waiting for kidney transplants to come off of dialysis. That doesn't include so many of our patients that have disease processes that will lead them to the wait list. If you look at a macro scale in the United States, there's about 104 to 105,000 people on the wait list today. And let's say, it's even greater than that. It's about 90%, 80 to 90%. So about 90,000 of those patients at any given time are waiting for kidneys, are on dialysis, right? Have that, disabled profile who may not be able to work, may not be able to, contribute in the best way economically to what they need to do in life, and are also, waiting for a donor to potentially say yes. So the impact is, significant to our community at a macro scale in the US, and then right here at home in New York in a very big way.
So, do you have an idea of how many people actually die because they didn't get the donor organ that they needed?
No, no, I don't know. I know that it's too
It's
many,
in the
and I know,
thousands.
yeah, definitely per year, right? Per
Right.
year, fortunately. Yeah. Yeah.
So now, when you joined Live On New York as the head of that, it was one of the lowest performing OPOs in the country. And you were told there were just no more donors in New York City. There's nothing we can do about it. What were your top three goals when you became CEO, and how have you done, and how long did it take?
Yeah, so when I came to New York to live on New York, a couple things were stated. One, and many of this were by my own colleagues and people who know the data. And one of those things was there are no more organ donors in New York. That was one of the first things. The second was, minorities don't donate. Black and Hispanics don't donate. The third was, you know what, geriatric patients, older patients don't believe that they can donate, and the comorbidity profile of the patients in New York will never lead to an increase.
Hmm.
And of course, first of all, I'm never one to kind of just listen to that or believe that level of punditry. But at the same time, we knew what the data was, and the data was horrific. We knew that many people were suffering. We also knew that New Yorkers were the most generous people on earth. We knew that if there was an opportunity to educate and engage the community, we believed that it could step up. And then once again, coming from the hospitals, if I were to assume that, yes, there are many people like me at every level within the organization, there's got to be an opportunity to increase this. And we had estimated that there was probably about 50% at least of patients not being referred or called in to Live on New York, which again, as part of that educational, goal, right? It was, hey, you guys are supposed to be calling. Part of the conditions of participation. These are regulations that exist. Things again that when we were in the hospital, we did not know. So that impact was significant. But the three goals ideally were, relentlessly focus and increase donation, decrease disparities, and give everybody possible the opportunity to just answer the question. It's not about us wanting everyone to say yes. It's about us asking the question if you would like to be a donor, if you'd like to save a life or live on and have a legacy. And those were the three big goals. So relentlessly increase donation, to get out there and speak to the community, engage, educate, and give everybody that opportunity to say yes or no to save a life.
Right. And those three strategic plans and your confidence and your experience and background led to a 70% increase in organ donations, which is
Yeah, and it's amazing. And
fantastic.
thanks to our donor hospitals, which we nod our head to, and my colleagues, and I mean there's 100 hospitals that Live On New York works with, and those are donor hospitals. But the donor hospitals increased referrals by 5x. So in that
Yes.
3-year period,
Wow.
yeah, 5x. So in 2022, when we initiated the plan, at any given time, Live On New York would be monitoring 30 to 40 patients across those 100 hospitals. Today, we're monitoring at least 250 to 300 any given day. And we, once again, thank the
These
nurses.
are people who are potential donors.
Correct. These are
Very,
these are patients who fit clinical criteria that we collaborate with the donor hospitals on. And then when they meet that clinical criteria, if they look as though they have a great prognosis or are heading in a direction, then the staff would call us for a further assessment to see if they are a potential donor.
Now, your strategic plan focused on education, community engagement, and amplifying donor stories. Can you share a specific initiative like the
Yeah.
partnership with elected officials on
Yeah.
the focus on Black, Hispanic, and Asian communities?
Sure. Three big things there, three big verticals there in that plan. The first was media engagement, and the thesis and idea was, can we engage media to help understand that there's not a recipient without a donor? Right? And in anything, whether it's Christmas, Hanukkah, organ transplantation, right? You have a recipient and you have a donor. And a lot of the focus had been on stories around the transplant recipients. And we all work to get everyone off of the wait list, and that's what our donors want to do. But what about the donors who said yes? Can we tell those stories? And a pinnacle sad moment happened, but for donation, it was a big advocacy moment in 2022 when Officer Mora was killed tragically, Police Officer Mora. And you might remember those headlines of the paper, Three Times a Hero. There were standing ovations at the Mass whenever organ donation was mentioned. And his yes saved many, many lives. And we engaged with the media to tell the story about the donor hero, about the person who said yes. That's resulted in nearly 9 billion with a B earned media engagements, where the
Wow.
stories have now been told in that way. The second thing was engaging with professional associations and organizations. So it's very hard to go to 100 different hospitals and engage on every unit. And as you know, every unit has a different culture, every floor has a different culture, and every hospital has a different culture. So the plan was, well, where do they all go? And they go to their professional associations and organizations, the American Association of Critical Care Nurses, the Black Nurses Association, the PA Association, EMTP Association, Healthcare Leaders of New York, right? The American, ACHE, the American College of Healthcare Executives. So we partnered and engaged with those entities
Hmm.
to elevate the story and the education and engagement around organ donation and become an ally and create allyship among those organizations to have impact. And we did the same thing at the community level with elected officials, getting into the 15 various counties, engaging with the elected officials and their staff, having everything from 5Ks to showing up to festive events to parades, and showing the community and helping them understand that the very things I believed, the urban legends and myths and issues that I believed, were not true. And in fact, this was a way, to retell a story and have a legacy. But that three-pronged strategy worked. It is significant. There are awards now given out by the FDNY for organ donation. There are awards given out by the Black Nurses Association, by the American Critical Care Association, by the Paramedic Association. There are 15 proclamations that have been received by elected officials to Live On New York, and at least five uh, name days thanking our donors. So different boroughs have named actual days for the donors who have said yes to save the lives. So all of that has added up to create a cycle of, you know what, this is interesting, this is okay, maybe it's not true what we heard. And it's all at the end of the day to reestablish trust in our community.
So you've gotten the word out and done an incredible job. It's fantastic. Tell us
Yeah.
about the story of Brendan Costello. That's a specific case.
Yeah, so Brendan Costello is a beloved New Yorker, long history in New York. There was just a front page cover story in the New York Times giving a nod to his life by Dan Barry, who's also a friend of his and of his sister's. And in that story, what had happened was Brendan unfortunately was coming to the end of his life, and the institution, by meeting that clinical criteria that he had, called Levon, and we saw that Brendan was a registered donor, which when we look to see who are registered donors, that only happens about 20% of the time, but we'll get back to that. So we saw that he was, and his sister, who's a nurse practitioner, wasn't aware of that. And you got to remember the impact here. So, and I've been there, you've been there, you've seen it on the hospital side. This is when a family's given the worst news of their life. This is when that moment happens that they say, can you sit down? Can we have a conversation? And when we're called at that moment, our staff, both obligated and needs to go there and, say, hey, we just want you to know that Brendan is a registered donor and he wants to save lives through having the legacy of being a donor hero. And that took place. And his sister came to grips with that right out of the gate, didn't know it, but said, wow, it's just very much like Brendan. And, he went on to save three lives, one of which ended up a directed donation. A directed donation just happened to be Brendan's sister's boss, another, psychiatrist leader here in the community who has served the public for a very long time, and it was a match. And just so you know, when it's not a match, it goes back to the federal wait list and it goes to the next person on the wait list. But in this case, a family has the right to, or donor has the right to, direct a donation to an individual. And if there's a match, it moves ahead. And that is what happened in that story. So, as I said to the reporter, and he had put in the paper, the sun, moon, and stars lined up in that circumstance. But it's just a capture of something that happens a few times a day in New York. And it's a New York story that was captured of all of these worlds colliding and the beautiful gift that can give that life back to somebody else.
It's a great story. Now, I understand that Governor Hochul just signed a bill that you advocated for, mandating organ donation education in driver pre-licensing courses. How do you see this changing New York's historically low donor registration rate of under 20% compared to other parts of the country where it's 60 or 70%?
Sure. So yeah, so in the New York metro region, downstate, when we enter a hospital, our data shows us that only about 20% of those that we engage with are actually registered donors, which means 80% of the time we've got to get families from 0 to 100 understanding it. And this just gets back to that decades long non-investment in donation broadly for all of us. And what this law does is it just adds another element. It adds another contact point and another educational point to learn about donations. So now, when you go for your pre-licensing course, information will be shared about donation, information that will dispel a lot of the things that you may otherwise believe if you're left to fill in the blanks. And the beautiful thing here is it's actually a follow-through on Lauren's Law. And Lauren's Law is why people are able to go and put that little heart on their license and sign up in the DMV. And believe it or not, Lauren Shields actually is an employee at Live On New York. And she is a, heart recipient and kidney recipient who, when she was a young girl, her and her mother advocated for that law. And today she works in an organization that collectively advocated for a continuation and another point of engagement with the community. But this and hundreds or thousands of other contact points, including our campaign, including our communications, including what we're doing today, having this conversation, all of that adds up to make people just think about donation in a different way.
So tell us in the audience, how does one become a registered donor? What do you have to do to do that?
Sure. So you can go to the Donate Life America National Database and sign up to be a donor. You can go to the New York State database. You can sign up at the DMV. And the thing that I always tell everybody is if you don't do that for whatever reason, at least tell your family. If you're in New York, because of what we see with the data, make sure your family and friends know what you represent. Make sure that they know that you want to save a life. Because again, 80% of the time, in that 70% increase across 3 years, it was family members and loved ones who said yes on behalf of their loved one. And they knew that they represented giving that gift of life to someone else. So those are the ways to do that.
Can they also do it on your website, on Live On New
Yeah,
York's
they can.
website?
If they go to liveonny.org, it will take you to the national and or state databases. So it'll just take you directly there and you can register there. Yeah.
I'll post that on the
Thank you.
talk,
Yeah.
post it online so that everyone.
Great. Great.
Now, you may know I recently interviewed about 4 weeks ago Dr. Jamie Locke, who's a transplant surgeon at NYU Langone Health, and she did surgery on a patient who received a genetically modified pig kidney, was transplanted into her because they couldn't get a human donor.
Yep.
She's been doing great now for several months already. So that was a major accomplishment. Hopefully, can be repeated and improved. I understand you've created the first ever advanced organ donor management fellowship with NYU Langone Health, where I'm an ophthalmologist. And that was announced in February. That's a
Yeah.
groundbreaking step. What inspired that initiative, and how do you envision it as elevating organ donation to a recognized medical specialty?
Yeah, so when you take like everything we've been talking about today and you think of, my voyage and my voyage again about reflection, I realized that even through that voyage of 25 years, I was never sitting in a room with a chief donation officer. There's no chair of organ donation in our hospitals in the United States of America.
Hmm.
Donation isn't recognized like transplantation, orthopedics, ophthalmology, cardiology, neurology, etc. Very similarly to, critical care adopting emergency medicine through the 70s and them rising through creating their own discipline within medicine. I got an idea when I first entered Live On New York and I started to think about it, coming fresh from the hospitals. Again, why is this so difficult? Why were we last in the nation? How could this improve? What are we missing? And a big component, not only in New York, but through the nation, was yes, we talk about transplant, and yes, we talk about the outcome of that donor's gift. But again, back on strategy, what about the donor? Who's focused on the donor and who's focused other than the OPO on increasing the education, engagement, the medical education, everything associated to the care of the donor who says yes to give that gift of life. And it didn't exist. So I went to Dr. Bob Montgomery and sat down with him, and it took, talk about an
He
elevator.
also, by the way, sorry to interrupt, but he also did that surgery with
Yeah,
heart
absolutely.
transplant with Dr. Locke. He's the
Absolutely.
chief of surgery at NYU.
Yeah, he's an amazing person,
Yeah.
amazing clinician and academic and researcher. Live on New York, and you may know this, but Live on New York, it's the donors that say yes through Live on New York staff that have had the xenotransplant at NYU for the majority of those, and also the more recent, whole eye transplant with Dr. Rodriguez. So on the donor side, again, it's the donor that says yes to enable these technologies and enable this innovation moving forward that we hope to help so many people. And Dr. Montgomery is a special person. It took less than 30 seconds of my pitch, which is kind of what I said to you about the thinking, for him to stand up and say, you know what, Lenny, we're behind this and we're going to make this happen together. And we did. And it is the first fellowship of its kind, official. So it's not like some marketing thing or just a name or, also known as it is an official fellowship that focuses on donation. I've already received a handful of calls from other organ procurement organizations, some of the leading in the nation, who have said, we want to do this too. And that is what we hope to see. We hope for it to spread, and we hope for it to expand to increase donation. What we hope to accomplish from it is kind of my layup on why we did it. Can this lead to 5 years from now, 10 years from now, whenever it is, can this lead to a day where we see donation as its own discipline, where it has its own resources and focus? And also, not only on the education side, but within the C-suite, within the donor hospital side, it's not enough that it's somebody's 100th job in a hospital. It's got to
Right.
be a primary focus, like anything else that you focus on, and then we will be able to continue to get people off the wait list through the grace of these donors. So it's again one of those 100 things, those 100 levers, along with everything else that we hope will increase donation across the nation.
That's awesome that you started that, and I think it's going to spread around the country, which would be great
Thank you.
for patients. Yeah. As you know, I mentioned I'm an ophthalmologist. I'm actually a cornea specialist, so I do corneal transplant surgery. I know there are eye banks in the New York metropolitan area and elsewhere who actually are involved in getting donor eyes. How do you interact with eye banks and other EOs that
Yeah.
specific for certain organs?
Yeah, so Live On New York is there's three different entities. So we are an organ procurement organization, and we're regulated by CMS in that regard. And that is one part of the organization. Another part of the organization is that we are a tissue bank, and that is another entity, which is regulated by the FDA, and the state and others. And then we have a foundation, which is another entity, for philanthropic nature, where we were able to develop and fund the fellowship. And when it comes to the tissue bank, we engage with the eye banks in the area, and we're not the ones going to procure and take the gifts of life that others have said will help others give that gift of sight. What we do is we work with the families, and when they say yes, we engage with the eye banks who then deploy their staff to do that and bring those back and our processors, and then are able to help, whether it's give people sight, or, in the case of burn victims with skin or bone, orthopedic procedures, just everything that a tissue donor can do. And we talk a lot about organ donation and the fact that it could save 8 lives, but a single tissue donor can change the lives of up to 75 to 100 people.
Uh, that's great. So you're also helping eye banks and
Yes, tissue banks and yep, absolutely.
we
Absolutely.
touched on this a little bit, but what do you think about electronic donor registries? How effective are they in increasing donations? And if not, what would be a more effective method?
Yeah, it's tough. So, there's a couple bills out there and a couple things that we're looking at and have been asked to pine on and look for advocacy for. And there's two different parts to that. One of them is instead of making the phone call to the organ procurement organization, should an organization just have an electronic medical record? We have two large systems in New York that do that today. And what we see when we compare them to actually talking to a person is that talking to a person is better. And, it's establishing a relationship, it's giving an opportunity to engage and educate about donation. But more importantly, there are fine details that, look, I'm a big proponent of machine learning and have worked, even in my role at HSS on innovation on firsts that are, both AI and machine learning entities. But there's something about HI, human intelligence, that I'm not sure could be just exactly replaced by it. So there's probably 5 or 10 different ways that it's being done. One of them can be a full feed, that's just a direct feed with the information. One of them could be a ping, which is saying, "Hey, call us back," and some OPOs do that. Others have a pop-up, like in an Epic or a Cerner. They'll have a pop-up when clinical conditions are met, telling the staff to call. That third option is probably one of the better options because there's a lot going on. It's busy. We know that it's busy for the staff, and the clinical conditions are not maybe always being looked at. But if in the system, while everyone's collaborating on that patient and potential donor, that alerts the staff to call, I think that's the happy medium between it all. There's a lot of opportunity and room for improvement. I think that we can get to a digital solution, but I think that the digital solution would have to be also enabled by people having a conversation. And things move different at different times in the hospital. So something may happen at 2 o'clock, get reported in the system at 5 o'clock, and find its way to us at 10 p.m. But a lot could change in that time period. So I think that the human interaction still has to take place. I'm a huge supporter of it if done the right way. I think that we just have to be careful about thinking it's a simple fix and be thoughtful about the approach like anything else that's digital. We should first operationalize it to make sure that it works operationally and then put digital technology on top of it to enhance and scale it.
Yeah, we can't leave it all to AI yet, right?
No, no, not sure ever, but happy to let it augment, support, scale, and be a partner and a co-pilot with us. But there are certain things that I just can't see that being done. And you're talking to a huge fan and a huge supporter of it broadly.
Now, I know you've emphasized respecting a patient's autonomy as a basic human right under Patient Bill of Rights. How do you address the misconceptions or resistance to organ donation, especially in communities where trust in healthcare might be low? We touched on that a little bit before. Can you
Yeah.
tell us some more?
Yeah, and I told you the front end of that, which was when we got to live on, they said there are no organ donation donors, that, Blacks and Hispanics don't donate, that the comorbidities would be an impact. Today, Live On New York increased donation 70%. So there were organ donors. The second part of that is we lead the nation in regard to honoring Black organ donors, also and lead the nation in honoring donors that are 65 and older. And we lead the nation in the placement of high KDPI kidneys. Using the KDPI index, these are often overlooked or seen as more damaged kidneys based on a scoring system. So Live On New York has debunked all of those things that were stated 3.5 years ago on arrival. And, a big opportunity, a big reason, and, right that we have to do it is because we respect individual rights and we respect the donor's rights and we want to optimize those gifts of life. So the thesis started very early. We did not do anything incredibly different or innovative. We did not. I wish I could sit here and tell you we had all of this great magical formula that fixed it. We looked back at the late 70s and early 80s at what the original intent was for organ procurement organizations, and that was to honor donors who were then voiceless, who knew that they wanted to give this gift of life and honor their wishes. That's where we started. And we treated everyone with, the utmost respect. Equitability is the bottom line and denominator of what we do. And then what happened was donation increased in the same footprint of the community we serve, the same demographics, the same age group, the patients with comorbidity. Everyone has a right to give that gift of life. So that's what we did. And it comes down to that trust. It comes down to the community engagement. We got out into the community. We stated these statements, and over each month and over each year, people were sitting in a room with others who said, "Oh, wow, I could be a donor too. I didn't know that I could." And that led to a beautiful cycle of giving that we hoped and prayed and knew that New Yorkers would step up to do. So that was what it was. Respecting that, number 21 in the New York Patient Bill of Rights is about donation. And it's the last one, but it's there. And we just want to give people that right, no differently than anything else in life that you choose to do with any material thing that you have. This is so much more precious than that, to give a part of you to somebody else so that you could live on and they could live on. That was where we started. We were relentless about it. We got out there and educated and engaged. But that was what was in the back of our mind the whole time, was respecting those wishes.
Now, looking ahead, what's the next big goal for Live On New York and the
Yeah,
leadership?
so in year
New
one,
technologies
yeah,
or new partnerships that you're looking at to keep pushing the donation rate even higher?
yeah, in year one, we called out, 20% increase that we saw was an opportunity. And in year one, there was a 30% increase in donation. And, we know that there is a lot of room for continued improvement. We know that a lot of people still want to say yes, and we know that we have a lot more work to do. So our goals are, primarily in year one, we wanted to make sure that we could repeat it in year two and scale it in year three. So even though we had that early success, we didn't want to share best practices because we didn't know if we had any. We didn't know if what we were doing, was it a fluke? Was it working? Was there something else going on? Was it just a response? In year two, we repeated it. And then in year three, we scaled it. We took things that didn't work, threw them away. We took things that did work, and we scaled them. And now, going into the next 3 years of our strategic plan, what we've started to do in 2025 is go more national and help. Open up a lot of the things that we've done, talk about what worked and what didn't. And we want to try to scale that as much as we possibly can and sharing because we're convinced now that we won't do any harm, right? If we just thought we knew what we were doing in year one and tried to give a recipe or formula, it could have hurt people. And we wanted to make sure it didn't. So that's the biggest part of what's next. Partnerships. For us, when we talk about a partnership, we talk about true strategic partnerships. We don't just throw that word around loosely. And we are, doing strategic partnerships with companies that leverage technologies, perfusion technologies, digital technologies to improve donation. And then we will opine and step into improving the overall system. There's a lot that is left to be desired in the algorithm. I mean, we've got technology in our mobile phones that are working better than a lot of what's out there in the ecosystem. And we know that, but we didn't want to be distracted. We wanted to focus on the gift and focus on our donors. And we will not stop doing that, but we will now take a step back and then broaden sharing and collaboration to try to improve where we can through the nation.
That's great. You've proven the concept. Now you want to grow it.
Yeah.
Now, for our audience that's listening, what's one actionable step they can take today to support organ donation inspired by Yvonne New
Yeah.
York?
So you've got a great audience that are smart people who understand the field and at the same time, just like me, who spent 25 years in it and thought I knew about it, I didn't. And I would just ask them to very simply, hear this message openly, you know, um, disbelieve and seek to prove, look up what we're talking about today, and help others understand the myths and misconceptions about donation, that they aren't real, and help us reestablish trust in our communities around donation. It's difficult. It's a difficult time for the ecosystem, rightfully being scrutinized and looked at across the board, and it should be. But at the same time, we want to make sure that people have trust in the system broadly and the healthcare system broadly. And the only way we're going to do that is by people who make up your audience helping us debunk these things, communicate, engage, and educate about the truths about donation.
That's great. Trust is the key word there. You repeated many
Absolutely.
times. And
Absolutely.
people understand that and believe that, and they will help out a lot.
Yeah.
So I want to thank you very much again for taking time from your busy schedule and
No,
day
thank you.
to come and speak to the audience about this extremely important topic. And appreciate it.
Thank you very much. And thank you to the audience. We appreciate you all. Take care.